Now it's time to move on to our next speaker. We have Dr. Jorge Pinto from FAO, and his talk is entitled Implementing Codex AMR Text in Low Middle Income Countries. Please join me in welcoming Dr. Jorge Pinto.
Well, good afternoon, and thank you very much for the invitation. Pleasure to be here. It's the second time in tour, and the other time I chose the wrong hotel. I was 30 minutes away, so this time they did it right. The organization is quite well done. So very happy to be here. And sometimes it's good to be one of the speakers in the afternoon, because I'll be speaking a lot about antimicrobial resistance, AMR. And we already had the first speaker, Jorge, very good friend and colleague, that gave a very broad overview of AMR, and a couple of talks mentioned AMR. So I don't need to do the generic introduction to the topic. I passed there. All right. That's not there. Okay, good. So so as I said, I hope by now everybody knows that AMR stands for antimicrobial resistance and AMU for antimicrobial use. And I will jump into Codex and implementing Codex AMR texts or standards in low and middle income countries. And I was speaking a lot about a project that we call ACT. You see there the abbreviation, Action to Support Implementation of Codex AMR Texts. And we chose the abbreviation as ACT in the sense of do something. AMR is such a big deal that it's time to act on it and do things. The full name is there, so I'll be covering a lot about this. Regarding AMR, so we spoke a lot about AMR in the beginning of the session. We spoke about AMR. And I am a food safety officer in Rome at the Food and Agriculture Organization of the UN. And so it's quite a big and complex organization, but as food safety officer, we worry more about foodborne AMR, the part of AMR that comes from food, the foodborne infections. And I think what's a good challenge for us is that AMR sometimes looks like this abstract concept. The genes, the determinants, they go back and forth and so on, but we can't really see it. You know? And this is the classical thing, the silent pandemic. We see the death, but we don't really understand or only see AMR. But if I say food, everybody here would have an answer. If I ask any of you, what does food mean to you? And it means pleasure, it means family, it means friends. It's a very obvious concept for all of us. When I say food, and some will say, I love pizza, I love sushi, whatever. It's a very concrete concept. But foodborne AMR is very abstract, and we don't really see. And I hope that nobody leaves this room thinking, next time I look at food, I'll be thinking about AMR. That's not the point, we're not there. But it's these two concepts that we usually don't tend to put together, infections necessarily of AMR via food. But we do know that people do get AMR foodborne infections. One of the challenges is quantifying this. How much of the AMR is foodborne, how much of the foodborne infections have AMR determinants, AMR genes, etc. So we are working on this project, as I said, ACT, and the key word, I think, is implementation. And I'll walk you through the process. There's this Codex texts, is like mini Bibles or mini texts, mini encyclopedias that need to be translated for the countries and then implemented. And the focus of the project is implementing in the countries, and I'll mention the countries that we are working on. And it's the first project in Codex to support its implementation. Usually, Codex is, I don't know if you are familiar, I'll briefly mention Codex, but it tends to be abstract. It's a lot of words. It's a lot of PDFs that you can print and read at home. So the focus is unique to have implementation. And it's the first project that is fully dedicated to foodborne AMR. AMR is so complex, you think about nosocomial infections, One Health transmission, etc., etc., etc. And this is focusing on foodborne AMR. That's what makes it unique. Regarding Codex, of course you have all the slides, so you don't need to read, and it's a very heavy slide here. But I think that the key words is this, is a body between FAO and WHO, so Food and Agriculture Organization, World Health Organization. And it sets standards. So you have there about 190 members, plus the observers. So it's quite complex. And the Codex involves a lot of negotiations until it gets translated into a text. And the Codex time is very different. For example, what we are working now is implementing 2 documents that took about 5 years to write. And in a Codex negotiation, you can spend one afternoon discussing one word. So if you like it, you like it. If you hate it, it's like it's nuts to be discussing this word in this line, and countries fight with each other. I like this word, but I don't like this word, and I like this word, but I don't like this word. I like to support the person that said that they like this word, and they spend one afternoon fighting about that word. So if you love it, you find the secret to love it is to understand why that word is so important. And usually there's a lot of money behind that word. And that's why the Codex standards can be interesting. So and this is more or less the overall idea. The words can be misleading. Sometimes you see standards or texts, but at the end it is a text that is printed and you can have it. And the key words is usually to protect public health, human health, and ensure fair trade. So these two words are very important when you think about Codex, or three. Texts to protect human health and protect trade, ensure fair trade. That's the proper terminology. So, as I said, Codex, if you don't translate into the field, it can be very dry. This presentation can be very dry. And there's a compendium of 3 standards related to foodborne AMR. You can, of course, download this from the internet. There's the guidelines for risk analysis. This is an older document. And then the guidelines on integrated monitoring and surveillance, all about data collection, interpretation, sharing, etc. And the code of practice. So I'll walk you very briefly, I promise, through this, just to get you an idea what we mean by these Codex standards. And there's a companion that has the 3 of them together. So this is what, if you are interested, if you leave this room in love with the topic of foodborne AMR, you can download it and put it in your... But it's not that long of a document. Huh? They are easy to read. And for example, I just put here, so the title, I think, summarizes it well. Guidelines of Integrated Monitoring and Surveillance of Foodborne AMR. So imagine yourself that you are the Minister of Agriculture of a country, and you want to say, how should I do it? How should I do this? Monitoring and surveillance of foodborne AMR. So these guidelines, in principle, will tell you all the answers that you are looking for, in principle. And so it's written there, these guidelines are intended to assist governments in the design and implementation of integrated monitoring and surveillance programs. And the key thing, if you read it, that data generated from national monitoring and surveillance programs on AMR in food should not be used to generate unjustified barriers to trade. So always have in mind that there's this, so someone was mentioning today, should we measure human death or dollars or euros, whatever you want to. And the Codex is all about that, protecting human health and assuring that countries can trade. And one of the work that we have been doing in these 6 countries I will present, it's all about that. It's ensuring that after the texts are implemented, they can trade with other countries, and they can say, we are doing it according with the Codex standards. So I said there's the guidelines of integrated surveillance and the code of practice. And Jorge in the morning mentioned this, for example. The code of practice will have sentence like the principles. The principles in these documents, if you have never read them, are very important. The definitions and the principles are super important in these documents. And then one principle will say responsible and prudent use of antimicrobial agents does not include the use of growth promotion of antimicrobial agents for growth promotion. So when we are working at the country level, this is what we need to say. So there's a document that has been agreed by these 190 countries that states very clearly this. So if a country is still using growth promotion, we have sort of the right to say, but look, the international agreement, it's not really a law, states this. So let's work to stop using it. This is the translation of a text that doesn't seem to be much to the field. So that's what we do. And then the importance of prevention, treatment, and control. The project itself. The budget is about $10 million, and you can see there's 6 countries involved, and since the beginning, I'm the lead technical officer of it, and I've really tried hard to understand the connection between 6 countries, and I couldn't. So if you can, please let me know. I cannot find something that puts together Colombia, Bolivia, Pakistan, Mongolia, Nepal, and Cambodia. They are very different countries. I think the donor wanted to give us a good challenge, like here's 6 very different countries, but I don't think there's anything in common. Perhaps there is, the donor is the Republic of Korea, and I think there is behind a very transparent way. We want to trade with these countries, and we want to make sure that these countries are respecting the Codex standards. So that's what we are doing, and as I said, to support the implementation of Codex standards. So we started in 2021. We are more or less in the middle, and it will be over in 2 years. Very briefly, objectives. I think these talks help a lot for this. I don't know how many of you knew about what the Codex standard was or Codex text was. So part of it is to increase the recognition that people know that these texts exist. As I said, there's a lot of work on surveillance and data collection, and then it's about code of good practices to prevent and control foodborne AMR. I told you, 5 years project, and then I'll briefly go over that. First you have some tools, we assess the countries, we do capacity development, and then you see if it worked or not. It's a quite logical, I think, project cycle. So I won't get into much into the details, and a lot of international organizations have assessment tools, and I'm a bit skeptical of this. I don't know, it's interesting to share it with audience like this. The assessment is useful, but it's only useful if then you follow up. There's a lot of work on assessments, a lot of tools that do assessments, and then you do that. You have a very complex mission and quite expensive. You do a beautiful assessment, you do a beautiful report, and that's it. And that should be the beginning of the work, but often is the end of the work. You wrote a beautiful assessment report and said, these are the list of problems, now good luck. So we try to move beyond that point. We have these tools, we assess these countries, and we develop the work plans based on that. There might be a colleague here in the room that you might recognize from Nepal in this picture, because we did, for example, assessments in all of them. For example, PMP evaluates the country in terms of AMR. Atlas is focusing on laboratories. So when you do this mission, your goal is to leave knowing this country has capacity at the laboratory to do analysis and surveillance or not, and that's what you have to do regarding laboratories. So very interesting missions. We assessed, and not surprisingly, these countries were chosen because they were in the initial phase of this work. So we had to work a lot to do capacity building, etc. Yes, so we can skip this. After the assessments, what we saw, there was a need to raise awareness, and I will speak a bit about awareness raising in a bit. So these assessments are not surprising, it's not rocket science. There was a need to raise awareness, there was a need to increase collaboration between governments and private practice. Surveillance is usually not top, and then there's a lot of law work. So you get from these codex standards, global texts, and then you need to translate into national policies. So you can see what we have been doing for the past years. Regarding raising awareness, my approach is also like the assessment. We do a lot of raising awareness issue. And I think one of the first meetings that I had with the FAO representative in Mongolia was quite interesting, and it really will keep in my mind. He didn't know me. And the first time we spoke, he said, besides raising awareness, what are you doing? And I love this approach, because every project starts with that. But it's like the assessment. If you just raise awareness and then doesn't lead to behavioral change, you just raise awareness. So we do have a lot of things, and you have to, but it's like the assessment. Raising awareness, for me, is not enough, even if you do a lot of work, and I think we should keep doing it. So 1 million events, 1 million conferences to raise awareness and hopefully to lead something else. So you can do this. Now, surveillance, data collection, I think there's a lot of people here with excellent epidemiology knowledge, and we all will agree that data is essential. We all love data. Without data, it's just Jorge's opinion, which is not worth much. So data is important. So we have been doing a lot, and in particular this platform. I think the next slides are a bit. For a long time, and Jorge mentioned this in the morning, we have been having good data on use at the global level. The OIE, or WOA, in Paris collects. I was deputy head of the AMR there. So I think there's a good global database of use, but for too many years there was not a global database of resistance. And you really need to understand that these are two parallel worlds that need to speak more together. So now we have a platform, FAO, and well, if you get into this, it's very clear. You need to understand the mandates. In Paris, use data is collecting. In Rome, resistance data is collecting. And the two things are very different, and they need to complement each other. So we have this new platform, which was a long wish for too many years. And it's not just a wish. Now we have 28 countries that submitted the data on resistance that they had from food, from animals, from sentinel farms. At the moment, we collect whatever country has, and then we'll start putting it together. And I think it will take us maybe 5 years to be sure that we have good data. It's part of the story. When we build a global platform, if we do it in 5 years, again, the time in global projects can be quite different, and I think it will be quite good. Now, I won't get into the details. This is just the summary is this. When the graphic designer presented the logo, I didn't get it. Hopefully you got it better than me. The idea is that something messy comes in from the left, goes through the platform, and something very organized comes out from the right. I didn't get it at all, but the graphic design is super obvious. People will clearly understand it. I didn't, but that's what it is. And the goal, you have to think again, if you are from a country, and if you're the prime minister of a country, I don't know how comfortable you say, well, in my country, there's a lot of resistance, right? It's a bit tricky, especially when you think about starting trade. So you need to be very brave to say, well, we looked at E. coli resistance in chicken, and there's a lot. So it's quite tricky. So to avoid this, for example, we understand that countries might want to start small and say, well, we put the data there, but we only can see it. Or we can only see it at the regional level, and the ones that really want to full disclosure, then they do full disclosure. But to start, some countries, they have more than the right to say, okay, I'll put the data there, but please don't show it. It's just there, the platform. And maybe in the future, we can open more. I think it's a fair start. So this platform is a big work that we have been doing. It was launched this year, and there's a manual for countries like, if you want to submit data, do it this way, which is really complex to collect it in a harmonized way. Another tool that we developed from the project is a tool to assess the countries from an interesting perspective. Sometimes you'll ask her, are you using growth promotion? And they will say, in the field. And I say, well, yeah. Do you have a law to stop using growth promotion? No. So the field, the reality, and the legal reality is very different sometimes. So the two ask the two things. In the field, in the practice, what is the situation? And the legal part, what is the situation? So this tool was developed by us to assess AMR aspects. And to help then countries move on, we have now a manual handbook, you can call it whatever you want, but the idea is to guide countries on a step-by-step approach, to say, okay, if you are still using growth promotion, it's pointless to use the blame game, but let's do it step-by-step and let's stop using growth promotion. It's one of the big, or phasing out, is more politically accepted, phase out, let's stop using it gradually, growth promotion. So to stop, to conclude, I think regarding foodborne AMR, or AMR in general, I think it's really a challenge. It's a global challenge, and we need to think what we need to focus. Someone said, well, international organizations need to do their role, individuals need to do their role, and clearly both parts need have a role to do. It's interesting to think that the solution, if you read, for example, there's a lot of interesting papers relating corruption with AMR, and the solution, if you start digging, is if you have an agri-food system wealthier, then you will have less AMR. It's very easy to say, it's very complex to do. But wealth in a country really helps, believe it or not, to control AMR. It's quite an interesting concept. Then, I think this is something that keeps coming up now. We tend to be egocentric, let's face it. Most of us, more or less, in different degrees, think about us, at least as us as humans, and we speak about, but the environment is very important. And this shift between being egocentric versus ecocentric, it's easy to say again, but it's challenging to do. But I think that's something that we need to start working on. And then regarding behavioral change, yesterday in the dinner I was telling this to someone. One of the things that I really tried to lead at the FAO, but it's very complex, is that to look at antibiotics as ours. And this is super complex to do. If it was mine, probably I would take better care of them than if it's something that is not really mine, it's just ours. But this concept of a global common good that we need to take care of, it's really complex, but I do think that if we get to that point, that caring about something that is not just mine, I think it will help us a lot to get to a better point regarding AMR. So that's it. I'll stop here, and there's my email address. Happy to collaborate with any of you. Thank you very much.
Do we have any question from the audience side? Yes.
Hi, my name is Daniela. I'm from Colombia. And I wanted to know if in the assessment you do a distinction between the rural part and the more industrialized productions, between family production and industrial production.
Yeah. I mean, clearly, it depends on the country. It's a very good question. And for example, your point is good because these are two different realities, no? And when I go to the missions to the country, I always try to go to the field. And these are two parallel worlds. The super industrialized farm knows about vaccines, biosecurity, and so on. And then you go to the other countries, and the farmer is sleeping with the chicken, right? And cooking, like the chickens are there, the bed is here, and the thing to cook is there. So it is, like, as I said, these projects as a presentation, it's relatively easy to summarize, but it is a different reality, no? And I think we passed the point of, there was at some point, and I'm Portuguese, so at some point, like, there was a trend of, well, we don't really need these small farmers. And many of them went out of business. Luckily now, I think, well, these small farmers mean a lot, and they have a lot of families behind, and they can have a significant impact, even in economic terms. So now we have to address them there. But so we do, the answer is we assess both, and it means almost two parallel work plans, because one is facing the big biosecurity and vaccines and so on, and the other one is, like you see many misknowledge of, well, we are giving them vitamins, and in reality it's antibiotics as growth promoters. But it's lack of knowledge, there's no bad intention. I'm doing this to see if I can sneak some antibiotics and make them grow faster. They just think they are giving vitamins. And that's when awareness raising is important to say, well, they are not really vitamins. Yeah.
And also, as a second question, do you know the difference between the impact in the use of antibiotics in the industrialized producers and in the rural producers? Like
the difference in?
The impact on AMR, like it's bigger in the industrialized productions or in the rural productions?
I'm not sure if I understand the difference in impact, or the difference if you have more AMR in industrialized or small farmers?
Yes, like if the use of antibiotics is worse used in industrialized productions or in rural
well, if I had to say, usually you should not do this. I think that in industrial production tends to be more careful these days because of trade, for example, because of residues control, because of international legislation, etc. So they tend, and I think there's much more, again, awareness. Like the veterinarian that provides assistance knows that, and like what Jorge was presenting this morning, knows that maybe I should use these antibiotics. Maybe they already have prescriptions, etc., etc., etc. So I would say in general that, I came back from Bolivia a few weeks ago, and we visited a farm that was fully aware. But usually, that's the disadvantage. When you go on a mission, they show you a good farm. They will not show you a bad farm. So they knew exactly what these concepts were. Sometimes, as I said, the small farmers, maybe they have more resistance. And it's interesting to discuss openly this, that just because it's small and local, it doesn't mean that there's less resistance. And sometimes there's this misconception, just because it's a small producer. Maybe, unfortunately, they're using antibiotics. They don't even know it. And the concept of withdrawal period is too complex. And then nobody took the time to explain to them. So it's, I would say in general, the more industrial productions tends to be these days more careful with the use of antibiotics. And probably this leads to less resistance.
Thank you.
Do we have any additional question from the audience? Yeah. Dr. Mark Damsdale. Yeah.
Yeah, thanks a lot for your presentation. I was wondering, could the World Trade Organization rely on the work you guys are doing at FAO to maybe implement some additional tariffs or bans on products that should be exported but actually have a high AMR content, if I may say?
Well, it's a very good question. In terms of, what we always say, so far, there has not been official trade dispute based on AMR. And this is good news. I think wars are never welcome, and a war between countries based on AMR, I think there's a lot out there already. We don't need AMR to be a reason for a trade dispute, official trade dispute. So that doesn't happen. When you get to the point of tariffs, for example, there's some work streams that those things are complex. For example, there is some research stream saying, well, if countries should just eat less meat or produce less meat. And this is very complex because you have to respect the country's cultures, respect the consumer's preference, etc., etc., etc. So there's pros and cons, and it's not clearly, okay, if you do this, we'll produce less meat, that therefore we use less antibiotics and we'll have less resistance. I think we need to be very careful on these things, and usually this extreme approach, okay, let's do this, let's make it meat production more complex, because that's the way to go, is usually really not that black and white or right and wrong thing to do. So I'll be cautious on taking that path.
I think that was our last question. So thank you, Dr. George, for that wonderful and interesting, insightful conversation today.